This is a grossing tutorial video on how to process a parotid gland for tumor or a superficial parotidectomy for tumor. The specimen is intact, predominantly smooth. There are no orientation markers, sutures, or clips. However, you should still try to make an effort in orienting the specimen and even inking it accordingly. So as you see here, we've got more of a flat side over here. We've got more of a convex side over here. We've got multifocal areas of cautery here, 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 here. And we also have a little area of adipose tissue here. Okay, and at the end of the adipose tissue is a dark red lymph node here. So once again, the specimen is intact. It's predominantly smooth. There's multiple areas of cautery. There's no orientation. We're going to go ahead and give 3 dimensions. Okay. So that's 9.0 by 4.7 by 4.4 cm. We're going to also look at the external surfaces to make sure that there is not any nerve or anything abnormal as far as what's been resected. So what I'm going to do is I'm going to ink the convex side blue. Okay. I'm going to ink the more flat side black. Like I said, you should try to make an effort, even if there's no orientation. Look at the anatomical appearance of it and structures present, and then ink it differentially anyways. And then the last part, I'm going to go ahead and put a little bit of green ink on the area of adipose tissue and also the lymph node. At this point, we're going to put a bunch of vinegar on the specimen. Let that sit for a few minutes. Then we'll come back to it and we'll section it. So we've inked the specimen, and now we're going to section it. And what I usually do is I section perpendicular to the long axis. So the axis is going this direction. We're going to cut perpendicular to it. Okay? And what I also like to do is I like to keep the water running adjacent to me in case it turns out to be a kind of a friable tumor. So we're going to begin sectioning, probably about 1 centimeter intervals, or less actually. It makes the look at that. It makes the sections later easier to take if you've cut fairly decent thin sections. So as you can see, there's this brown cloudy fluid coming out, which is pretty typical of a Warthin's tumor. So we're going to continue on. It's really wow. we have now sectioned the specimen from one end to the opposite end here. We have lesional tissue in these slices here and here. We've got the area of adipose tissue here. We've got some normal glandular parenchyma here, which I usually describe as finely lobulated, firm glandular parenchyma. But once again, from these slices to here, this is all lesional tissue. So this lesion has predominantly replaced or obliterated almost the entire parotid gland. As far as describing the lesion, I'm going to describe it as tan, dark red, variegated, with multifocal areas of attached tan, brown, turbid fluid or material. I'm also going to talk about the capsule, because the capsule is predominantly uniform all along the outside of this lesion here, all this stuff here. There's no real thickened areas. And once again, here we have more normal glandular parenchyma here. We have fat here. And the fat, we're going to go through and look for any lymph nodes, because there was at least one that I saw externally here. As far as sections go, we're going to do 1 section per centimeter. If there's any areas of necrosis, which I don't really see any, I'm going to sample those areas. But once again, 1 section per centimeter. Look for lymph nodes here. Some normal glandular parenchyma here. And that's it. Thank you for watching.